This patient was experiencing issues with her under eyes, and that's a really common complaint I see in my practice. Of course, under eye filler is one of the more popular things that patients are aware of, and so most patients, when they come in, they think, I need under eye filler. This is a great example of someone who came in, said, I have a little valley by my eye, it's creating a dark circle, I want under eye filler. My goal is to educate the patient and explain to them why that's actually not the case, particularly in this situation. As we can see in her before photo, she does have some volume loss under her eyes, but the major contributor here is volume loss from the cheek. When we lose volume in our cheeks, the cheek slides down and in. So particularly in this young girl who's also quite thin, lost a fair amount of volume through her cheek, and I treated it with cheek volume. I used Sculptra for that purpose. So this is 2 syringes of Sculptra injected onto her cheekbone arch. And as that developed and more collagen was stimulated, it helped to pick up her cheek and help to seam back together the lid-cheek junction, or that under eye hollow, and that way she got to avoid under eye filler. This is a longer lasting solution, and it directly impacts the actual issue, which is cheek volume loss, dropping the cheek and exposing the under eye hollow, as opposed to just going in there and putting in a filler. I use topical cream to numb her cheeks, and then the procedure is performed through multiple little injections. Of course, once the topical cream is applied, it's quite comfortable, so it's not painful. And it takes about 2 to 3 weeks for her to get a full result, and then sometimes we do a touch-up 4 to 6 weeks later. But again, this will be a long-lasting result, so 2 years is still there, in some studies up to 5. And she's been a patient for multiple years, and I've seen her back at 2 years and then again at 4 years. And by 4 years, she did need a little touch-up.